Welcome, Dr. Morse, injury experts. So I wanted to discuss a topic today that just came out in the news the past couple of hours about J.J.McCarthy. Now, the national award winner unfortunately suffered a significant knee injury earlier in the year in preseason, and that required season-ending repair of his meniscus. Let's step back a little bit and say, what do we learn from this quote that he provided today here? So we didn't have specifics, but now we do. We know where the meniscal tear was and what type of tear it was. So rarely do we get this type of specific information, but we will take it. And it's from the horse's mouth, so we know it's true and legit. Let's look at the knee and try to figure out why this happened, what stresses caused this, and how he'll potentially be in about a year when he's available to play again. So if we look at the knee, we have lateral compartment, medial compartment, patellofemoral kneecap. This is traditionally where we have our issues, the medial compartment. If you look on the side, when we put any weight on it, look where all the stress goes. That posterior meniscus, okay? The back part. The meniscus is this blue part. Now, one of them is shaped like a C, the other one is shaped kind of like a moon. The medial is really, they're both important, but the medial is really important. And the problem with the medial compartment is that a lot of people think they walk like this, but in actuality, they actually have a lot more stress. So they end up putting a lot more pressure on that medial compartment. And as a result, that's why a lot of people have more wear and tear on the medial aspect of their knee, whether it's MCL, whether it's meniscus, or whether it's cartilage. For this specific situation, he suffered a medial meniscal tear here, but even further, he told us the type of tear it was. Now, I'm going to show you this cool little model. This is what a meniscus looks like. So this is the one he suffered right here. See how there's a little gash right there? Now you see the red zone, the red part? That is close to the periphery. That's the only part of the meniscus that heals. Look where that radial tear is. It's not near the red. That would have never healed, ever. Now, I assumed that it was this type of tear. This is a bucket handle, this is a bad tear. But he wouldn't have been able to move. These usually lock, catch, you can't function. He did this in a game and then a couple days later found out that it was bothering him. So it pretty much couldn't have been a bucket handle. So now we get clarity. It wasn't a degenerative wear and tear. It wasn't a flap tear. It wasn't a longitudinal or horizontal tear, we call them. It wasn't a longitudinal tear. It was a radial tear. So what did the surgeon do? They went in and sutured this and put it back together. So when he pivots and uses, he can handle that load in that medial compartment of that knee. 3 to 6 months from now, he'll be able to start running again, cutting again, and within the next 6 months after that, he'll be able to play and he'll have no restrictions at all. Unfortunate injury, unfortunate timing, rare insight from a player himself about the specifics of the knee injury, but nonetheless, I think he'll be fine and good to go in 2025, and we use this almost like a red shirt year where he starts learning the offense and learning the play calls and everything else, but nonetheless, hopefully you found this interesting. If you have any questions or comments, I'd love to hear them below. Thank you for tuning in. Take care.